First step towards accessing your best XLH care is going to be clinical evaluation. The clinic should review a full patient history, take x-rays to look for rickets and osteomalacia, and also do biochemical tests to look at the levels of phosphate and other markers. The clinical diagnosis of XLH should then be confirmed by genetic analysis of the PHEX gene with a further workup aimed at diagnosing the presence and severity of disease complications. First-generation family members of an XLH patient should also be investigated for XLH. For your best XLH care, regular checkups and transitional care are both going to be really important. Children with XLH should be seen at least every 3 months during phases of rapid growth, such as infancy and puberty, as well as after beginning any treatment. Adult patients should be seen every 6 months if receiving treatment, or once a year if not being treated with any medication. Genetic counselling should be offered to patients with XLH, especially at the transition from child to adult care and to families planning pregnancies. Specialist teams are very important for the best XLH care. Patient care should be provided by multidisciplinary teams organised by an expert in metabolic bone diseases. Persisting deformity and/or the presence of symptoms interfering with mobility should be considered for surgical treatment by a surgeon with expertise in metabolic bone diseases. Hearing tests should play an important part in your XLH care. Patients and families should be informed that hearing problems might occur and that any suspicion of hearing impairment should be investigated thoroughly. Dental care is a key part of accessing your best XLH care. Adults with XLH should have a dental checkup at least every 6 months if they do not already need dental work. Some children with XLH may also need regular dental treatment. An important part of accessing your best XLH care is musculoskeletal treatment. Interventions aimed at improving functional mobility as well as attempting to reduce bone and joint pain, deformity, stiffness and muscular weakness are recommended. Neurological assessments are an important part of XLH care. Alongside regular checkups, we suggest a yearly basic neurological assessment. Where patients do not have any neurological symptoms, we do not recommend further investigations. But patients and families with any concerns about central nervous system function should report them to their consultant so that they can be addressed promptly. Medication and new treatments are a major part of accessing your best XLH care. One option for children and symptomatic adults may be a combination of oral phosphate and active vitamin D. Children and adults should be assessed by their consultant to understand the most suitable treatment available for them. Patient organisations could be crucial to helping you to access your best XLH care. These resources can provide invaluable support and up-to-date information for patients and their families. For more information about XLH, please visit xlhuk.org.